All right now at 5:30, Air Tracker 5 is live over the Wolstein Center at Cleveland State University. That's where the state's first mass vaccination clinic is now up and running. The governor says this is about stepping up our state's efforts to vaccinate eligible Ohioans, especially the most vulnerable.
With an explicit focus on communities with a high risk of COVID-19 exposure and infection. Those include the Black and brown communities and medically underserved, hit hardest by the pandemic.
And by Monday, the Wolstein Center will be able to vaccinate as many as 6,000 people each day. The governor says of the 25,000 people who live within a mile of the center, nearly 2/3 represent historically marginalized communities. Rob.
We're talking about those communities that have been both disproportionately impacted by the pandemic and underrepresented in our state's vaccination rates. It's one of the reasons this location was chosen. That, and of course, it's easy access from public transportation. Once you make your appointment, all you need to do pretty much is show up. But as our Kevin Barry learned in this News 5 original, sometimes even that can be a challenge.
I talked to a lady yesterday. Her husband's in a wheelchair. She doesn't read or write.
That's why Maureen D's work getting Cleveland's Hispanic community vaccinated is a huge logistical puzzle. Many people are able to sign up online for a vaccine appointment and show up to get their shot at CSU's mass vaccine location. But other members aren't tech savvy, don't get around well, or are intimidated by a part of the city they don't go to often.
And so this is the community that we're trying to assist to connect with the vaccine.
FEMA and state agencies have already reached out to Cleveland's Hispanic Roundtable, setting aside 1,500 appointments at the mass vaccination site over the next 8 weeks. The next steps for Maureen is to make sure people are scheduled for those times, make sure they know where to go, and that they have help overcoming any language barrier.
We need to be so sensitive to those communication challenges and cultural challenges that the individuals face.
The mass vaccine site opening this week isn't the only way to get underserved population their shots. In Glenville,
I have to be honest, I wasn't going to get it at first, but I changed my mind.
Brenda Benton wants to travel soon, and Johnson & Johnson's one-shot vaccine means she only had to brave a needle once. She's gone from skeptic to the vaccine's biggest champion.
Hopefully everybody will get vaccinated. Hopefully everybody will come out and just do it. Let's just do it.
That's a big deal for Dr. Ola Luafayanju.
It means everything. It gives me a ton of hope that people can change.
He's running Oak Street Health's vaccination program. Their locations are already in underserved communities, so instead of transporting patients downtown, Oak Street Health is getting vaccines from university hospitals for patients like Brenda. Last week, they started with 300.
It's a small dent, but one of my favorite sayings is, how do you eat a whale? One bite at a time.
Dr. Fayanju says the mass vaccine site is better for some people and Oak Street Health is better for others. What's more important is giving people options and telling them about patients like Brenda.
The authenticity of her experience will touch more hearts, and her example will probably do more than anything that I can say.
I'm hoping that it will change the minds of people that just don't believe.
In Cleveland, I'm Kevin Barry, News 5.
Now, the Hispanic Roundtable tells News 5 it is continuing to vaccinate people in the Hispanic community as well through local churches and neighborhood family practices. And today, County Executive Armin Budish announced an effort to get more vaccines into those underserved communities and neighborhoods with mobile vaccination vans, with more information on that coming up later this week.